Good morning, Exercise Science. This is the fourth and final lecture for Chapter 14, the respiratory system. Plans are that at about the same time I'm going to be posting this video on Monday morning. I will probably be posting your assessment for this chapter as well. We'll finish that up, probably have that due sometime midweek. And again, I'll have instructions for you online so you'll know the definites of everything, but just kind of want to go over that with you as you watch this. And after that, we're done. As far as chapters go, I am going to do some cumulative assessment for you with some questions from the year, as well as a muscle review. That'll be more project-based. I haven't quite figured out what that's going to look like yet, but as I think of that, I'll share that with you. So let's finish up this chapter. Respiration. We talked about a number of different things. Got into gas exchange, internal respiration. I did ask you to look over the certain disorders, diseases. I asked you a few questions. I haven't been able to look at those responses yet. I'll probably ask you a few more questions about diseases as well. But today I want to finish up how we typically finish up the chapter, effects of aging and homeostasis. So when you look at the respiratory system, and I want you to think about this even before you listen to the next couple minutes of this video, think about what can go wrong with the respiratory system as you get older. You know, what's going to be the issues? I mean, all it is basically is a system of tubes and bags that allow for gas exchange. The biggest issues that are going to be faced by people as they age as far as the respiratory system go are relative to the elasticity of the lung tissue itself. And that is going to restrict your vital capacity. So we talked about restrictive disorders, the inability to fully inflate the lungs. That's one of the big challenges that people have as they get older. Restrictive capacity or the vital capacity decreasing because the lungs become restricted. Hardening of the tissues, smooth muscle replaced by connective tissue, so on and so forth. So you just can't take those big breaths anymore. That's going to reduce the amount of oxygen that you get in the body at a max rate. Some other things that can happen related to the immune system, the cilia, which line the airway, which I haven't discussed with you. It is in the notes. These are small little hair-like appendages, and they're not hair, but they look like hair, and they whip in unison. And what they do is they basically sweep debris out of the lungs. So as you inhale air, you're going to get dust in there. You're going to get some debris, some particulate matter. The mucus lining the airways is going to trap that, and then the cilia sweep it up, and then every time you swallow, that's going to be at the base of the trachea, the superior portion of the trachea, and it's going to go down the esophagus. So basically your body's way of kind of cleaning the lungs out, and then when you cough and sometimes remove a little bit extra when you have a cold or something like that. So those cilia are going to decrease in number as you get older. So the ability to fight infection, because obviously respiratory system is a pathway for many types of infections. The ability to fight infections is going to be less. That combined with the decline in white blood cells and the overall immune response, double-edged sword for people as they age, they get more respiratory infections. The last thing, you have to think a little deeper about this one. The capillary networks that surround the alveoli. Obviously very delicate balance there, one cell thick. Not only the alveoli, the simple squamous epithelium, but the lining or the casing of the capillaries is also one cell thick. Obviously allows for diffusion. Those capillary networks, I don't want you to visualize them just poof going away, but they degenerate. Just like anything else as we get older, they degenerate, they lose their efficiency. So the ability to exchange oxygen for CO2 or CO2 for O2 declines as we get older because of the breakdown of the capillary networks, the degeneration, the slow degeneration of the capillary networks around the lungs. So the combination of not being able to take in as much air with a single breath and the less efficient gas exchange occurring is going to just equal less oxygen in the bloodstream. Maybe you'll have to increase your rate of respiration. There's a way the body's around this. You can't just simply not have enough oxygen. That's going to spell doom. All right, it doesn't work. So there are ways around this, but at the same time, your body, just like all the other systems we discussed, becomes less efficient, declines, degeneration, those type of words. Going to homeostasis, the respiratory system works with a number of different systems to maintain homeostasis. The cardiovascular system is an obvious one for gas exchange between the capillary networks, the bloodstream, and the lung tissue. The immune system works to protect, as we just discussed a couple of minutes ago, the respiratory system. Cardiovascular system, immune system, those are the two big ones that I can think off the top of my head. Trying to bring some other ones out of there, but those are the ones I want you to focus on as you're answering questions from the assessment. I'm sure there's a few other ones in the notes. You could probably talk about the endocrine system, controlling the diameter of the airways. Hormones will do that, the constriction and the dilation of the airways. Nervous system obviously affects respiratory rate by increasing, decreasing respiration. That brings me to another point. A question that I'll probably ask you is breathing voluntary or involuntary? I want you to think about that. Obviously, there's some control by the nervous system. Whether it's voluntary or involuntary is one that I want you to ponder a little bit, and I'll probably throw that question on the assessment as well. So that is it. That's going to wrap up Chapter 14. Have a good day, and make sure to start looking ahead as we wrap this up, because we are at a point now where it's less than 2 weeks until we're finished. Have a good day.